Hello everyone and welcome again. So continuing our discussion about the orthopedic trauma basic principles class, and after we talked about the early complications of fractures, now we are going to talk about the late complications. And now we already talked about the delayed union, the non-union and the malunion in the fracture healing outcomes video. It is a video in the same playlist as this video. But here we will talk about the other late complications like the joint stiffness, the joint instability, osteoarthritis, avascular necrosis, and the bed sores. So let's start. So let's start with the joint stiffness. So the joint becomes difficult to move, and it mostly occurs after fractures. So it's basically difficulty in moving the joint. Common locations for stiffness is the knee joint, the elbow, the shoulder, and the small joints of the hands. Causes of the stiffness include the joint capsule fibrosis, adhesions, edema that occur due to prolonged immobilization of the joint, and the treatment by exercising the joint early after the fracture occurred, and if it is already stiffed, then physiotherapy is needed for the joint to be back to normal health. The other complications is the joint instability, and that's when there is sensation of the joint may give away. Causes include ligamentous laxity, muscle weakness, and bone loss near the joint. And the joint instability may lead to recurrent dislocations, especially in the shoulder and in the patella. The other complication we have is the osteoarthritis. The osteoarthritis is the degeneration of the joint cartilages, and it occurs when the fracture is inside the joint capsule, damaging the articular cartilage. And it is either post-traumatic osteoarthritis or secondary osteoarthritis. So in the post-traumatic, it occurs in periods of months after the injury due to direct damage to the cartilage, and in the secondary arthritis, occurs years later due to irregularity of the joint surface because of not so perfect reduction. So the first one is that there is a trauma to the articular cartilage, and the second one, the reduction is not perfect, so it would lead to secondary osteoarthritis. So here we have an X-ray images of the knee. In the left picture, the normal knee joint, but in the right picture, the osteoarthritic knee joint. So we can notice that the joint space. So this is the joint space here. This is the normal joint space, but here, as we can see, it is reduced. It is less than 3 millimeters. If it is less than 3 millimeters, then it is an osteoarthritic change. We can also notice that there is an osteophytes here, and we also notice that there is subchondral sclerosis. As we can see here, there is increased density in the subchondral bone, and in the normal one we can see that. So there is another picture of the osteoarthritis. So in this X-ray image, we can see that there is metacarpophalangeal joint osteoarthritis on the right and on the left of the second finger, and we can see that there is, on the left hand, there is decrease in the joint space, but on the right hand is no joint space at all, and there is also subchondral sclerosis on the right. So the right one is far more severe than the left. So yeah. The other complication is the avascular necrosis. So some bones and parts of bones have high risk of developing ischemia and necrosis after injury because of the poor blood supply to these bones. Common bones are the femoral head, the proximal part of the scaphoid bone, the lunate bone, and the body of the talus bone. Ischemia occurs initially following the injury, but clinical features and radiological features of the necrosis seen after weeks or months, and the patient present with pain at the injured bone. An X-ray shows osteopenia, patchy sclerosis, and rim calcification. So here we have an x-ray of the hip joint. So the left one, the left femoral head, has avascular necrosis, as we can see here, compared to the right one. So there is increased density of the head compared to the right one, and there is articular surface irregularities here. So those are two signs of the avascular necrosis of the head of the femur. Finally, let's talk about the bed sores. So those are ulcers that form due to prolonged pressure on the skin, mostly in elderly and paralyzed patients that are hospitalized for a long time, or from wearing a cast for a long time too. They commonly form over the sacrum and heels, and here we have a picture of the most common locations for them. So it will be over the sacrum, the heels, also the back here, and even the head. And treatment is difficult. Excision and grafting is an option, and negative pressure dressing is advised. And with that, we reach the end of this video. Thank you guys for watching. Please make sure to like and subscribe. And if you want to support more, you can by subscribing to the Patreon, link provided in the description of this page. Thank you for watching. Peace.